A little device is making a big difference for patients with congestive heart failure. So take a look. This is roughly about the size of kind of like a paper clip. Doctors actually implant this tiny little thing. It's so hard to see there. They implant this in the blood vessel, and as Lindsay Reiser shows us, it's keeping patients out of the hospital.
Hey Patricia, hey, how are you doing?
This is how Dr. Vijay Swara with Abrazo Arizona Heart Hospital likes to greet patients, with a hug and a handshake rather than in the emergency room.
He's going to dive and take some pictures.
But for patients Patricia Parker and Richard Heine, who both suffer from congestive heart failure, a trip to the ER was becoming a regular routine.
And I had like 3 months in a row of it.
It's usually about a 2-day, 3-day procedure.
Patients go into congestive heart failure when the heart can't keep up with the body's needs.
Blood backs up in the lungs. It causes fluid to accumulate in the lungs as well as in the body.
But patients usually don't feel any different until it's too late.
You don't. Not until all of a sudden you say, oh my God, I can't breathe.
But once they've gained more than 5 or 10 pounds, the oral medications don't work and they will need to be hospitalized to get them back to where they were.
But now, thanks to this little device called a CardioMEMS, Dr. Swarup knows when a patient is headed in the wrong direction, weeks before any symptoms show up.
So it is a simple pressure transducer. So it records the pressure and we put it in the pulmonary artery.
Each day, the patient lies down on a pillow-like device and it takes a reading and sends it to the doctor.
So it gives us a window of time when the pressures are up, but the patient has no idea. And we can act during this time before there is any significant fluid accumulation.
Neither Parker nor Heine have needed a trip to the ER since having the sensor implanted, meaning less damage to their hearts and richer lives ahead.
Certainly my heart right now is not something I need to worry about. They're taking care of that.
It can only make things better, and it has.
Lindsay Reiser, 3TV.
So the doctor also says even though the device stays in your artery, it doesn't affect your blood flow. And aside from lying on that pillow every day, there's really nothing more patients need to do. Pretty cool technology.